The most severe of these benign anorectal conditions is the fistula in ano, which is actually an infection of the anal gland. Hi, my name is Dr. Chinnaya Parimi, consultant gastrointestinal and colorectal surgeon at Apollo Spectra Hospital, Kondapur, Hyderabad. In this video, we are going to discuss the common problems people have with their anus. Every problem people have with their anus is not from piles, which is the most common term used to describe all the symptoms you have in that area. Pain most commonly is from a problem called anal fissure, which happens because of constipation, tearing the anal canal, which leads to intense sphincter spasm. This is the most common reason people have pain during their bowel movements. Most of these can be treated with medication, but the root cause of constipation has to be handled. The diagnosis of piles or hemorrhoids people talk about, the most common way it presents is with painless bleeding during bowel movements. Operations are necessary sometimes depending on the significance of the symptoms, but handling the primary root cause, which is the constipation and the altered bowel function, is extremely important. The most severe of these benign anorectal conditions is the fistula in ano, which is actually an infection of the anal gland, which can present with a pus pocket, which is a perianal abscess, which can eventually rupture through your buttock onto the skin, leading to discharge, which can go on and off over months or even years. Like any other disease process, this is a wide spectrum, starting from the simple-most to the more complex, where the fistula traverses a lot of muscle, leading to a more complicated anatomy requiring extensive operations. Avoiding constipation and straining is the biggest intervention you can take to prevent most of these symptoms. But in some people, these do happen. You do need either medical management or sometimes operations. Most of these conditions, like the hemorrhoids or the piles or the anal fissure, can be treated with medical management without needing an operation. But fistula, 99% or even 100% of the time, does need an operation. If you have any of these symptoms and would like to see a colorectal specialist, please see us at Apollo Spectra Hospital, Kondapur.